Many people live with chronic inflammation and unexplained health issues, never realizing that the foods they eat could be the root cause. Even foods considered healthy can trigger problems if your body is sensitive to them. With advances in testing, it's now possible to pinpoint which foods might be causing your symptoms. Understanding your food sensitivities can be a game changer for your health, helping you address issues like fatigue, digestive problems, and more. In this video, we'll explore the science behind food sensitivities, the types of immune responses involved, and the various testing methods available to help you take control of your well-being. You have a food sensitivity. Your body treats certain foods as threats, triggering an overactive immune response. This can involve both the innate and adaptive immune systems. The result? Chronic inflammation, digestive discomfort, headaches, and even joint pain. Unlike classic allergies, food sensitivities often cause delayed symptoms, making them hard to identify. You might feel fine after eating, but hours or even days later, symptoms can appear. That's why testing is so important. It helps you connect the dots between what you eat and how you feel. Within our bodies, a family of proteins called immunoglobulins act as antibodies, each with a unique role in our immune defense. There are 5 main types: IgG, IgA, IgM, IgE, and IgD. IgG is the most common in blood. IgA protects mucous membranes. IgE is linked to allergic reactions. IgM is the first responder in new infections, and IgD is rare but important. These immunoglobulins help the body recognize and respond to foreign substances, including food proteins. Understanding which immunoglobulin is involved can help determine whether you're dealing with a true allergy or a sensitivity. E antibodies are responsible for classic, immediate allergic reactions, what doctors call allergy type I when you're exposed to an allergen, like peanuts or pollen. IgE triggers the release of chemicals such as histamine, causing symptoms like hives, swelling, or even anaphylactic shock. These reactions can be severe and require immediate attention. Allergy testing for IgE is common, using blood tests or skin prick tests to identify specific triggers. If you've ever had a skin prick test at the allergist, this is what they were measuring. It's important to know that food allergies can be life-threatening, unlike most food sensitivities. Symptoms of IgE-mediated allergies often appear within minutes of exposure. They can range from mild to severe, including hives, swelling, itchy or watery eyes, vomiting, diarrhea, and even difficulty breathing. In some cases, exposure to even a tiny amount of the allergen can cause a dangerous reaction, requiring emergency treatment with an epinephrine injection. If you experience these symptoms, it's crucial to seek medical help immediately. Understanding the difference between an allergy and a sensitivity is key to managing your health safely. Diagnose IgE-mediated allergies. Doctors use blood tests to measure total and specific IgE antibodies, or skin prick tests to see how your skin reacts to different allergens. Common triggers include pollen, dust, animal dander, certain foods, and medications. These tests help pinpoint what's causing your symptoms, guiding you and your healthcare provider in managing your allergies. Sometimes, blood tests are preferred if you can't have skin testing, such as if you have a skin condition or are taking certain medications. Not all food reactions are caused by IgE antibodies. Non-IgE-mediated food sensitivities involve other parts of the immune system, like IgG, IgA, and IgM. These reactions are usually delayed, making them harder to spot. Symptoms can show up hours or even days after eating the offending food, and may include digestive issues, headaches, joint pain, or fatigue. Unlike allergies, these sensitivities are rarely life-threatening but can significantly impact your quality of life. Testing for these types of reactions can help you identify and eliminate problematic foods. Repeated exposure to foods you're sensitive to can lead to chronic inflammation and a host of health problems. These may include digestive discomfort, muscle and joint pain, migraines, chronic fatigue, insomnia, and even autoimmune conditions. The tricky part is that symptoms can appear up to 72 hours after eating the problematic food, making it difficult to identify the culprit without proper testing. Removing these foods from your diet and allowing your gut to heal can make a dramatic difference in your health and energy levels. Celiac disease is a specific autoimmune condition triggered by gluten, a protein found in wheat, rye, and barley. People with celiac disease produce antibodies like antigliadin and anti-tissue transglutaminase, which attack the lining of the small intestine. This can lead to nutrient deficiencies and a range of symptoms. However, you can be sensitive to gluten without having celiac disease. Standard celiac tests only check for certain antibodies, so a negative result doesn't always mean you're not sensitive to gluten. Comprehensive testing is key for accurate diagnosis. One of the most thorough tests for food sensitivities is the IgG Food Panel Test. This blood test checks for IgG antibodies to hundreds of foods, helping you identify which foods may be causing delayed reactions. It's important to note that IgG testing is not the same as classic allergy testing, which looks for IgE antibodies. The IgG Food Test, FOX, for example, analyzes your blood for IgG reactions and provides personalized guidance based on your results. While some medical associations are skeptical, many people find that eliminating foods based on IgG results leads to symptom improvement. For taking an IgG food panel test, there are important guidelines to follow. Avoid testing if you're sick or have had cortisone injections, chemotherapy, or certain medications recently. Children should wait at least 9 months after their last vaccination. On test day, fast for 4 hours before your blood draw. Samples must be sent to the lab quickly, and results are usually available within 8-10 days. Always consult with a healthcare professional to interpret your results and plan dietary changes safely. If you're needle phobic or want a broader analysis, hair and saliva tests are available. Hair analysis can check for sensitivities to hundreds of foods and non-food items, as well as metal toxicity and gut health. Saliva testing is especially useful for children and can help screen for celiac disease early. These methods are less invasive and can provide valuable insights, but it's important to use reputable labs and interpret results with professional guidance. More detailed analysis, ELISA enzyme-linked immunosorbent assay, tests can measure immune responses to specific foods and even check for gut permeability by measuring zonulin levels. Genetic testing can determine your risk for celiac disease and gluten sensitivity using blood or mouth swab samples. These advanced tests can be expensive, but offer comprehensive insights, especially if you have ongoing symptoms or a family history of autoimmune conditions. People use pulse testing or muscle response testing to check for food sensitivities at home. Pulse testing involves measuring your heart rate before and after exposure to a food. An increase in heart rate may indicate a sensitivity. Muscle response testing, used by kinesiologists, checks for changes in muscle strength when exposed to foods. While these methods can offer clues, they are not as reliable as laboratory tests and should be used with caution. One of the most effective ways to identify food sensitivities is the elimination diet. Remove common trigger foods like gluten, dairy, eggs, and soy for about 6 weeks, then reintroduce them one at a time while keeping a detailed food journal. Track any changes in symptoms as you eliminate and reintroduce foods. This method, combined with immunoglobulin testing, can give you a clear picture of your unique sensitivities and help you make informed dietary choices. Food sensitivities can be hidden culprits behind many chronic health issues. With a variety of testing options available, from IgE and IgG blood tests to hair, saliva, and genetic testing, you can uncover your unique triggers and make changes that support your well-being. Always consult with a healthcare professional before making major dietary changes, and remember that understanding your body is the first step toward better health. By identifying and eliminating problematic foods, you can reduce inflammation, boost your energy, and feel your best.
Welcome. Today I'll show you exactly how to join Beautique and make your first purchase. I'll guide you through every step, from choosing your account type to completing your order. Start by opening the main menu to explore our mission and the products section. You can join as a customer for rewards or as a member to start your own business. The sign-up form is straightforward. Just enter your contact details and shipping information. Members will also provide a few extra details to set up their independent distributorship. Once registered, browse our full catalog and select the high-quality products you'd like to try. Once logged in, simply find your favorite products, add them to your cart, and click Checkout Now to complete your order. You're now ready to start your journey with Beautique. We're excited to have you with us.